is Dr. Kyle Richmond. For those that have been here for the last however many weeks I've been doing this, welcome back. If you're new, hello. I own Rebuild Strength and Rehab in New Lenox, Illinois. I'm a sports chiropractor. I say sports chiropractor, more of like a basically active people chiropractor. So anyone who works out, has a busy lifestyle, job, plumbers, electricians, blue collar workers, even desk workers, see a lot, see a little bit of everything, but not your typical, hey, line up, lay on the table, adjust you, see you later. More towards that physical therapy side of things. I have a background in played a lot of sports growing up, did CrossFit for a long period of time, so I know what it feels like to be in pain. I know what low back pain is, neck pain, foot pain. I mean, I've had a little bit of everything in my time being. I even get back pain just sitting here and working all day with patients, being bent over the treatment table here. So today's topic is going to be on neck pain. Neck pain, it affects everybody. I think from people getting a kink in their neck when they sleep, to stress from working, to even just tension headaches from everyday life. People who have no physical stressors but have a lot of internal, like stress and anxiety, can get these tension headaches even though they move well. So let's go in and answer a few questions based off neck pain. I think I had a couple on foot pain as well, but let's start with the basics. Let's talk about the neck in general. So the spine moves in a lot of different directions. Like our neck can do a full 360 almost range of motion. But there's two range of motion that are very important to the spine, and that is flexion, which is down, and extension, which is back. Primary motion of the spine, here and back. Where do we spend most of our time through all different kinds of jobs and lifestyles? Unfortunately, it's through flexion, or head down and forward, okay? The other range of motion we have are rotation, lateral bend, and then protraction, retraction. So what I want everyone to do, whether you're watching this live or afterwards, let's run through a range of motion test. What I want you to see is what you feel, whether it's painful, pinch, tightness, achiness, whatever. The two rules are don't push through anything that's super painful or pinchy, and the second rule is don't push anything that makes you dizzy or uncomfortable. Some people who have neck pain, they'll push through a range of motion, makes them dizzy, nauseous, etc. So first things first, you can be sitting back in a chair, you can be relaxed, you can be sitting upright. You are going to tuck your chin down to your chest. This is flexion. You're going to see what you feel. Most people feel stretch in the back of their neck. We're going to come on up, and we're going to put our heads into protraction. So we're going to push our chin forward. You should probably feel a little bit back here. Next, we're going to bring ourselves into retraction. So we're going to think about taking our chin straight back. A lot of people feel stretch in the back of their head. That's the one we're going to touch on real soon. Chin tucks. The next one, extension. Chin all the way up and back. See how that one feels. A lot of people feel stretch in the front of their necks. Something we don't do a lot during our day. Then we're going to go to rotation. Look over one shoulder. See how far you can get. Let's look over the other shoulder. See how far you get. A lot of us will notice it's easier to look to our right. That's where we look when we drive. It's to our right. Left is sometimes a little stickier. Last one's lateral bend. So think about ear to shoulder. Good. And ear to shoulder. If you move your neck around all those range of motion, you experience some pinchingness, some like sharp pains, or maybe numbness and tingling that goes down the arm, you need to look at your neck range of motion. That's one of the most important things we talk about in neck pain. If you have a restriction somewhere, odds are you're going to have pain at some point. If you can't look over your shoulder, if you can't bend your ear towards your shoulder, you're setting yourself up for discomfort. And we would say the same thing for our shoulders, right? If you can't raise your shoulder past here, well, at some point that's going to become painful if you can't do all of this. So a lot of my patients, I run through that kind of neck screen, super basic, super easy, but it's a good way to see how well your neck's moving. It's all the ranges of motion outside of doing like a full neck circle, and that's more advanced. We can get that on a later date. But if you ran through that, you take a baseline, see where you're at. We can talk about all the individual things if you lack certain range of motions there, but the one range of motion I want to always have in my neck is retraction and extension. I'll get into that shortly. So, which brings me to my first question. What actually causes tension headaches? Stress or activity? I feel like I get them all the time lately. There's a couple things that can cause these tension or stress headaches. Is the actual muscles themselves being tight and pulling. So we have muscles from our neck that attach to the base of our skull, behind our ear, behind here, muscles that run up into our temples, wrap around. If you are under a lot of stress here forwards, little muscles in the back of your head called your suboccipitals get super stressed from being here all the time. Those muscles get tight, they get angry, they start to pull more on the base of our head, and it can create tension all across here. That's a mechanical stressor. So that's like physical activity or being in these positions for a long period of time, looking down, clenching. A lot of people clench their jaw, or they just hold a lot of tension in their traps when they're stressed or anxious. That can play a part. I think a big one, water. A lot of people are not hydrated enough. I recommend drinking enough water throughout your day and electrolytes. You need to have electrolytes in there if you're not having a very processed food diet. So let's talk about that real quick. And this is important when it comes to tension headaches or migraines. If you're not eating a lot of processed foods, you're not probably having a lot of sodium in your diet. Most people don't salt their foods because we've always thought sodium is bad. Well, we need sodium to let our brain function, our muscles function. So a lot of us will go and slam 3-4 of these a day, 120, 150 ounces of water, but they don't replenish with the electrolytes, which is the sodium. And then they don't eat any really bad foods. They're not getting sodium in there. Like if you're eating like takeout or Chinese food or something processed, it's usually a lot of sodium or a lot of sugar, so you're probably hitting your marks, but you need to make sure you're also adding in electrolytes. So that's super important when it comes to these tension headaches we get. If you've been hungover, you're getting this migraine. Your brain is dehydrating, so it's going to start aching. You're going to get a lot of issues there. So water, salt, electrolytes. I like Element, LMNT, whatever you want to call it. There's some good brands out there. Just be careful of what the sugar is in a lot of these. Some are loaded up with sugars and just stuff you don't need in there. Furthermore on that question, so stress, activity, and hydration. Stress gets us more tightened up here. When we're anxious and breathing, let's call it just breathing more anxious, we tend to breathe through our traps and our neck more. Remember, traps, scalenes, all the muscles in the front attached to our head, and this ends up taking the brute force. So an easy exercise to do for anyone with neck pain, I start a lot of my patients at, and why we talked about that neck screen before, is simply chin tucks. Placing our hands on our chin, bring our chin back. You're gonna feel a stretch in the back of your neck here, these muscles. It's gonna help take some tension off of there. That's just step one. I recommend if you're at your desk throughout your day, stretch, come off. Stretch, come off. Most of us wanna do this. Head down, stretch here, stretch here. Feels good because stretching has an analgesic effect, which means it takes pain away temporarily, but it doesn't fully get rid of what the issue is in terms of the little muscles, suboccipitals. So if you look those up, they're the ones that go from base of your skull into like top part of that neck there. Those only get stretched when we bring our chin straight back. So if we read the next one here, is tech neck really a thing, or do we just make that up? Well, tech neck falls into that same category we just talked about earlier of this head protracted, chin down looking here. It's a real thing, and what muscles get angry is the stuff back here and then even base of our neck into our upper trap. Getting our chin back and up and then working into extension can help offset that. So good examples like taking your finger and just holding it back here all day, this would not feel good. We have to make sure that we're moving it all directions, or if you just stayed here all day and you didn't get back here, our spine's the same way. If we're only in one position all the time, we have to be in the other position too. Low back, mid back, all the same principles. So I hope I answered that one well for you. It kind of blends into everything else. Tech neck is a real thing. We just call it tech neck because we're always looking down at technology. It's really just called bad posture. Just being here all the time, doing stuff. Like you can see where my chin is. No one's sitting up like this, doing this. This is also not really comfortable, so I don't recommend it. Like you're not gonna sit here on your phone for hours like this. You're probably gonna be in this position, but what you're gonna do is you're gonna offset by doing exercises to get back here. Other things are great are like manual therapy, seeing a chiropractor, seeing a PT, seeing a massage therapist, doing stuff at home. Obviously we have our Vibits, which I think are really great for even just massaging back there. Even if you don't turn on the vibration, you don't have to have it on. You can use this to massage the back part of that neck, laying on there, rotating back and forth, flexing, extending. Tennis balls are great, lacrosse balls are good, but something that has the little ridges and can get into those little muscles. They're really small, delicate muscles, so don't drive in with a lot of force. If you feel okay, you turn this on very light, but I don't recommend putting anything on the base of your skull that's super vibrating and can kind of irritate things. So tech neck, real thing. There's some ways to treat it. Do you have any daily stretch routines to help with upper back tightness or any tools? So upper back, first, is making sure that we can move our neck well, and the second is, I'm gonna grab my other chair, I'm gonna show you. All right, so if you have a low back chair, this is your best friend. Let's see if I can see here. Otherwise, a foam roller on the ground will also do the same thing. But I tell people to hands placed behind the neck, elbows in front to pull our scaps forward and out of the way. And we're going to lean back and over our chair. Feel a huge stretch in the back. Come on off it. Back in the chair. Come on off it. Same thing with our neck. I recommend 10, 15 of these at a time, a few times throughout our day. Make sure I answered that question well too. And there's also, you can do some like rotational stuff. A lot of people go here, but I would make sure you have adequate extension in your spine, especially your upper back, first before anything else. All right, a couple more here. Can foot pain mess with neck or upper back? I personally don't think so. I know there's some books and maybe research out there. It says like the fascial lines all play a role. Is it connected? Not really. I think what happens is when you have foot pain, you tend to walk around less and move less. Ipso facto, you're sitting more, which will make your back hurt more, which will put you in worse positions for your neck. But it's not like, hey, if you massage your feet, like your head's gonna feel better. If that is the case, it could be, if you go back, I think 2 lives, we talked about pain in the nervous system. You could reduce your nervous system sensitivity by doing some soft tissue work in one area. Can help make things feel better than the other. But like if you had right side neck pain and left side foot pain, they're not directly connected because of one or the other. It's just overall systemic, inflammation and pain. We've got one more here, unless we have some more. If you guys are live here and have questions, please feel free to put them in the comment section. I can answer them live, or we can always get them on the next one. Last one I have here, what's something easy I can do if my feet are sore all the time? Number one is roll. Take care of them from a soft tissue perspective. Vibration and manual therapy, or like myofascial release, feels great. But if you're running the same cycle of I have pain, I do some work, I feel better, have pain, do some work, feel better, you need to either increase the tolerance of your tissue, which means strength. Make your feet stronger. That's going to help at least increase the tolerance. The other thing you have to look at is modifying your lifestyle. What are you doing? Are you walking a ton? Do you not have good shoes? And good shoes can mean 2 things for people. Are they supportive enough, or are they restricting your feet too much? So if you have like a wide foot and the toe box is essentially squeezing your feet, well, that's not going to feel good. If you have super flat arches that are weak and you need a little more support from an orthotic, awesome. So lifestyle modifications, making sure your feet are strong, and you can stretch daily. Big toe stretches, plantar fascia stretches, Achilles stretches, anything above and below is beneficial to stretch. But stretching is just kind of a temporary thing for most people. It'll feel good. Analgesic means reduce pain, but try to do more than just stretch. I recommend a daily mobility routine. If you can find one that is something that works for you, I have some programs that I have people go through that are 5-10 minutes a day of just moving. But to answer your question, what's something easy you can do? I would say start with myofascial release. If you don't have a Vibit, a tennis ball can suffice for a little bit of time, but the combination of this is obviously very beneficial. I think a big misconception is like only certain people get foot pain. Like my feet are sore right now. I've been on my feet for a ton this week. Did a lot of walking, biking, exercising. My feet are sore. So I start by this. I help reduce it. But if I'm constantly getting problems over and over and over, I need to look at the bigger solution. That's why people come to see me. They try to find the actual solution to pair up with soft tissue work. Because you can do this at home, but what are the other things you need to do? So strength, lifestyle modifications, sometimes diet, not have enough magnesium in your diet, not have enough sodium, potassium, all that. Electrolytes play a huge factor too, depending if it's like a cramping, if it's a neurological pain. A lot of people get aggravated sometimes when I answer questions and I say it depends, because a lot of things depend. Not everything's super black and white, especially when you look at pain science and our anatomy in general. Like, not everyone's back pain is the same, not everyone's neck pain is the same. So to recap everything we talked about today, a lot of us focus on the neck. I highly recommend getting more motion in your neck. So if you're someone who sits or you're working with kids or little ones on the ground, get that retraction and extension back in your neck before anything else, and you're going to notice a massive difference in your neck pain and stiffness. We're always here. We need to be not just here, but back the other way. If that's all from everybody, I know we're a little late. I apologize. Thank you for watching these back afterwards. We've had some great feedback. I love doing these. Look forward to seeing you guys next week. I don't know what we'll talk about, but the team will send out some emails, gather some questions, and we'll continue to go from there. So you guys have a great weekend. We'll talk soon.